Hello, everyone. Welcome to the Flint Community Webinar, your community resource every Friday at noon. We've got a really great lineup for you today, and we're excited to bring some of our partners here today to talk to you about really important information. We've got a really great couple of people here to talk to us today, and we'll go to the next slide. First, we're going to start with a little bit of an update. So we've got a lead pipe replacement settlement update, and we're going to talk a little bit about a town hall that's going to happen to talk about this. And this is March 28th, 5:30 to 7:30 in the Flint Public Library. Definitely come out to get more details and information about this lawsuit. And we'll share updates about the status of pipe replacement in the program and residents' right. And everyone is welcome. Again, that's March 28th, 5:30 to 7:30 at the Flint Public Library.
Yep, and we have Sarah Tallman here who's going to tell us.
Yep. Yeah.
Great, thanks so much. Thanks for having me on. So yeah, just repeating again the info about the event. It is March 28th, next Tuesday night at 5:30 to 7:30. You can come in person. It's at the Flint Public Library. There is also going to be a live stream of the event. And so the info is at the bottom of our flyer. It's nrdc.org/Flint meeting, and that will redirect you to a live stream. And I believe viewers will have the opportunity to post comments and questions. So if you're not able to attend in person, you can still participate. We will also have an ASL interpreter present to facilitate additional accessibility. So what is this town hall? We are talking about updates about the lead pipe replacement settlement, which is part of a lawsuit brought by NRDC, which is the Natural Resources Defense Council, ACLU of Michigan, Concerned Pastors for Social Action, and Flint resident Melissa Mays. So this lawsuit was brought under the Safe Drinking Water Act all the way back in 2016. We resolved the case, which was against the city of Flint and state officials, in March of 2017. So almost exactly 6 years ago, we resolved the lawsuit through a settlement agreement that is enforceable by a federal court and requires the city to find and replace all of its lead pipes, and importantly, to restore residents' properties after they do the pipe work. So just super quickly, some updates for what's going on and what has been going on. As of January, the city had dug up more than 27,000 service lines and replaced more than 10,000 lead and galvanized steel pipes. There are 31,578 total eligible homes. So the city is not done going everywhere yet and has not finished its outreach to community members to encourage folks to participate. Residents have to provide the city with consent in order to do the work. If you haven't yet submitted a consent form and still want to participate, the city is still accepting folks who want to still participate in the program. And the consent form is available online through the city's Get the Lead Out website. And there you can download it and submit the form online or in person or via mail. So this past fall, our groups went back to court because the city had not upheld its end of the requirements under the settlement, and it hadn't finished this pipe replacement work on time. The work was originally supposed to be finished in January 2020. That did not happen. Then the pandemic happened and there were other delays, but the work is still not done. So we went back to court to ask the court to impose additional reporting and planning requirements to make sure that the work finally gets done. We were also in court about the city's failure to track its property restoration work. So as you all know, I'm sure, when they do the pipe replacements, they have to dig a large hole in folks' lawns, and that may involve also damage to sidewalks, curbs, and driveways. The city is required to repair that damage, but it has left, thousands of homes with holes in the yard, or they just did a temporary backfill but didn't properly do seeding and, make the ground level, or they've left damage to sidewalks and driveways. So we were in court to try to force the city to get its act together to actually finish this work and make sure it, number one, figures out where work is still needed, and number two, it finishes that work. Our motion was successful, and in February, the court issued a ruling granting our motion and imposing new requirements on the city. That includes an August 1st, 2023 deadline to finish all pipe replacements and excavations. That's excluding the restoration piece. And then there's an upcoming May 1st deadline for the city to at least figure out where it still needs to go to do those property repairs. So once it figures out whether there are 6,000 homes that still need property repair or 10,000, so after it figures out the scope of that remaining work, then there's a required process to figure out an appropriate deadline to get that work done. So we are monitoring the city's progress on a weekly basis to try to make sure that this work actually gets done this calendar year, if at all possible, because the project has been ongoing for far too long at this point. We're going to share more details at our community town hall event this upcoming Tuesday. And we'll also have fact sheets to distribute, including sort of, we have a Know Your Rights fact sheet that kind of articulates for residents exactly what they should expect and what benefits are guaranteed to them by this agreement. And we'll have those materials in English, Spanish, and Arabic as well to promote accessibility. That was a lot of information. Happy to take questions. I'm happy to put a link, a Facebook link to the event page in the chat, and hopefully folks can help us spread the word about the event on social media and through your networks. And we're really hoping that as many folks as possible are able to participate either in person or virtually.
Thank you so much, Sarah. Really appreciate all that really helpful information. And yes, a Facebook link would be amazing if you could throw that in the chat, and we'll certainly make sure that gets circulated. I wanted to ask, is there a resource that community members should reach out to if they are currently experiencing an issue? So let's say they've had some of that work done that you described, and maybe no one has done the repairs outside as you described. You know, is there a specific resource that residents should think about?
Yeah, so there are at least two resources available. So first, the city is in the first instance managing this program and is responsible for completing that work. So you can reach out to the city. That information is on our fact sheet, and I can put it in the chat. I believe it's gettheleadout@cityoflint.com, and there's an associated phone number. If folks are having trouble accessing the city or still have questions, they can also contact us. And that information is also on our fact sheets, which I will include, but the email is flintpiperemoval@gmail.com. And that is, that's owned by NRDC. We just wanted an easy to remember email address. So it's flintpiperemoval@gmail.com. And we monitor that for any questions. The phone number, and I can also put this in the chat, is 312-651-7918. And yeah, any issues we're eager to understand, because it helps our groups, the plaintiffs in the case, monitor what the city is doing and what the problems are. So in order for us to be able to continue to hold the city's feet to the fire to make sure this work gets done, it's critical for us to understand which addresses are still having problems, and if there are things that the city is doing that it shouldn't be. It's super helpful for us to know that. So we welcome all concerns and questions, both to us or to the city directly, of course.
Absolutely. And then are you all planning to have future town halls if someone isn't able to attend this town hall either virtually or in person? Do you anticipate that there will be other town halls down the line?
So we're gonna get through this one first. The live stream my understanding of the technology is that it will remain live on YouTube, or not live, but it'll sit there on YouTube. So anyone that isn't able to make it can watch it afterward. And of course, if there's further milestones or points in time where it would be helpful to spread information in this way, we're happy to put them on. I think our goal is to promote transparency and try to share information as far and wide as possible. So yeah, we welcome all avenues and ideas for ways to do that.
So if someone, it's good to know that the live stream will be sort of recorded and available on YouTube. And if someone, isn't able to attend, then they can watch the recording and maybe reach out to those resources that'll be in the fact sheet if they still have questions or follow up.
Yep.
Do you have a sense of how many people you think will attend so far?
I hope as many as possible. I
know,
think
right?
when I last checked the Facebook page where we're taking RSVPs,
Yeah.
we had about 120 interested, but about 20 or so saying they were an affirmative yes.
Yeah.
So I hope those numbers will continue to go up as the information continues to circulate through the community.
Yeah, it's such an important resource to be like in person and virtual and have these different modalities of being able to get the information out and make sure people can engage with the information. Super appreciate all the work you are doing to make sure that people get this information and they get in time resources and information about how we can move forward, right? And how we can, if they have questions, how they can manage those and good resources. So thank you so much for that work and your time and telling us about this today.
Of course, thanks so much for having me.
Absolutely. I think we have Max Salvatore as well.
Yes. Hi, everyone. My name is Max Salvatore, and I work on community engagement and
Max,
recruitment.
I'm sorry for saying your name incorrectly.
Oh, no, that is actually how it's pronounced. So
okay, good to know. So we're
Yeah,
switching gears a little bit. Thanks for being with us today. We're switching topics a little bit, and you're going to talk to us a little bit about some resources that there are in the community for understanding colon cancer.
Yeah. So I work on community engagement and recruitment for a study called the Michigan Cancer and Research on the Environment Study, which is based at the University of Michigan. But the goal is to recruit over 100,000 Michiganders between the ages of 25 and 44 to understand the impacts of harmful environmental exposures on intermediate cancer outcomes and cancer risk. So it is quite a long-term study. We launched in June, and we have, I think, a little over 2,000 people enrolled. But I've sort of been tasked with doing outreach and engagement in the Flint community. So obviously, I'm invested in getting Flint representation in this study. So happy to talk about that, but that's not what I'm here to talk about. The study is offering us a sort of a suite of community resources to inform the community on topics related to their health. And this is open to anyone, not only people who are enrolled in this study. So we are actually launching, this is the first webinar in our webinar series. And the topic is why is colon cancer becoming more common in young adults? The webinar is on Tuesday, March 28th at noon. And will be, you can register for it on Zoom or watch it on our Facebook page. I'll be dropping more information in the chat about that, but it's 45 minutes. My favorite part about this is that it's a 15-minute, a pretty short presentation, but then the community attendees can ask questions sort of to the people who are presenting that week. And so this week we have Dr. Elena Stoffel, who is a colon cancer expert at Michigan, who has been studying the increase in young onset colon cancer. And I've met with her personally, and she's just a great resource. And so I'm really excited. There will be future webinars that will also be free, and we'll be promoting that on our social media and our website, and on different topics too, topics like what are microplastics and how do they end up in my body, and like candles and what they're made of, and indoor air quality and how that impacts your health. And so we're actually pretty open as well. So if anyone has any ideas of things that they'd be interested in learning more about, we hope to be responsive to community interests as well. So again, the webinar is Tuesday, March 28th at noon. I will drop the Zoom link and the Facebook link in the chat, and please feel free to reach out to me if you have any questions.
So Tuesday is going to be a big day for the community because your
Yeah.
webinar is at noon, and then we've got the town hall later that day. So if you were looking for things to do, we have brought you a few things to do on your lunch hour and in your evening. This is really incredible in terms of resources, right? One of the things we hear about a lot is we want trusted information on what we need to do with our health and how we can be sort of armed with the necessary material that we need to sort of go to our doctors with, right? And this, as a physician, this particular topic of colon cancer screening guidelines, and we've recently changed the colon cancer screening guidelines so that they're younger. And how do we communicate that to people, right? I think it's important, obviously, as providers that we're talking about it, but it's really nice when someone comes in with some context already, right? When a patient is like, oh, I watched this webinar and I learned that I might be at risk for colon cancer, and doc, what do you think, right? And we've long talked on the webinar about how healthcare should be decision making between both parties, right? It should be getting informed information from the people who have that expertise, and then that you as a person have to sort of then be armed and make those decisions. And I just really appreciate the work that you're doing, sort of getting people trusted information in this space. It's really important.
Yeah, no, thank you so much. Yeah, I think the study is housed at Public Health, and so we are really interested in getting information out to folks. Our website and social media will be sharing, we'll sort of be recirculating news stories related to environmental exposures and health. We'll also be sharing resources where we translate research results into lay-friendly formats like infographics. And again, we'll be featuring more things like the webinar series on there as well. We are really interested. All of those resources are free to anyone, and not just people who are participating in the study. So yeah, we're really excited about this, and hopefully our first webinar goes well.
I hope it goes well too. I'm sure it's really great information. I have to give you a little bit of a nudge because I'm a go green person, and I always, whenever we're talking Michigan,
oh yeah,
I gotta rep Michigan State right back. So appreciate you talking about this amazing resource. Thank you so much.
Yeah, no, thank you so much.
All right. So we've talked about a few really important resources that are in the community. Thank you so much to our teams for talking about the town hall that is also Tuesday, and this amazing resource that's going to talk a little bit about colon cancer on Tuesday. The rest of our webinar today is going to focus on more education. We've got Dr. Esch, who's going to talk to us a lot about pediatric gun safety. And this felt important, and we've heard stuff like this from you. The community really enjoyed our pediatric safety and prevention webinar that was a few weeks ago. And it felt like as we go into spring break season, hearing more about sort of what we do with our kids and how we keep them safe could be really important. And Dr. Esch is going to talk to us about that. And then we've got Dr. Learoff, who's going to answer some important questions that we've heard from the community around STI rates and sexually transmitted infections and how we prevent those and what they're looking like in the Flint community. So thank you so much for your engagement today, and I'll let Dr. Esch start off with talking to us a little bit more about pediatric gun safety and what we should know.
Thank you so much. I am going to share my screen. So as Dr. Edwards-Johnson said, my name is Dr. Gurbaksh Esch. I work very well for the Pediatric Public Health Initiative through Michigan State University in Flint. I'm also one of the pediatricians at Hurley Children's Clinic. So thank you so much. So we'll talk about pediatric gun safety overview. So as we know, we have seen a lot of firearm violence in our country as of late, especially and specifically in our state. A little over a year ago, or I guess a couple of years ago now, we saw the Oxford High School shooting. And then very, very recently, I actually just moved from Lansing to the Metro Detroit area, but was living in Lansing at the time when we saw the Michigan State University shooting. I was living about 20 minutes away. And it was very terrifying for a lot of us. So we are seeing a lot of firearm violence. I am new to medicine, fairly new. I graduated residency in 2021, and so have been working as an attending physician for only 2 years. But I myself have seen firearm violence, and it's not always the school shootings that we see in the news. So I took care of a little one, a 2-year-old, who had an unintentional injury to himself. So he found a gun in an office desk that was not locked. And people as little as 2 years of age can accidentally shoot themselves. So he shot himself in his belly and was being taken care of in the hospital for a few months. He survived. I saw a 13-year-old in residency who was shot by her brother, who had a long history of depression and anxiety, and unfortunately passed away. And then I have seen and taken care of a 15-year-old girl who was shot by her friend when they were kind of messing around with a gun at home. So, as someone who hasn't been working as a pediatrician for very long, I have seen this, in my clinical practice and taken care of kiddos who have been victims of gun violence. So this is a very, very important topic, as I'm sure you all know. Equally understanding that it's important in the United States in general. So more recently in 2020, firearm related injury is now the leading cause of death in pediatrics. So kids are dying because of gun violence more frequently than they're dying of motor vehicle accidents, so car accidents, poisoning, drug overdoses. So this is a big deal. This has had a significant increase in the past couple years. We saw a large increase during the COVID-19 pandemic as well. And then just talking a little bit more about the importance. So about a little under 50% of US households with children have a gun in the home, with at least 15% of these homes storing at least one of those firearms loaded and unlocked. So that means they have the ammunition and they are unlocked. So they have ammunition in the gun and they are somewhere where a child could access them. Like I said, we hear in the news a lot about school shootings and mass shootings, but in fact, a lot of the firearm related deaths in children are actually due to things like suicide, homicide, so getting caught in crossfires or arguments. Unintentional injuries account for a smaller proportion, but usually those kiddos that are aged about like 2 to 5 years old. And then, of course, the school mass shootings. Over 3/4 of pediatric related suicide by gun or firearm occurs in households with easy access. So these are the kiddos who live in households where the firearm is unlocked and loaded. And then we've seen a 63% increase in firearm related suicides in our youth, so our adolescents that are 15 to 24 from 2005 to 2019. And suicide is the leading cause of firearm related deaths in our country. And well, I guess I don't know about in our state, but definitely in our country. And then 80% of unintentional deaths. So these are deaths where young children get a hold of a gun and accidentally shoot themselves or shoot someone else. In young children occur in their own home while playing with a firearm. So obviously we need to talk about safety and how we can keep our kids safe from these unintentional or intentional deaths. So I think I wanted to start this out talking about safety and keeping our kids safe with what pediatricians should be doing to protect your children. And to protect children in general. So at each well visit that you go to, or that, someone that has kids go to, your pediatrician should be asking you or the parents, the legal guardians, if there are firearms in the home, and if there are firearms, how are they stored? If this is something that you haven't been asked or that hasn't been brought up, then I really encourage you to bring this up at visits. There should be education on safe storage of firearms. We'll talk a little bit more about what that means in the next slide. And they should also be asking you if you are asking other parents about guns in the home and storage. The preteens and teens should be having depression screenings during their well visits. So attending these well visits is super, super important, especially for any age, but especially for our preteens and teens. And if the screening is positive, meaning that there might be evidence of depression, anxiety, some sort of mental illness, then if there are guns or firearms in the home, then the pediatrician should be discussing risks of having a gun in the home and safe removal of firearm access for those that are at risk of suicide. And then advocacy, pediatricians are doing advocacy at the state and federal level for firearm safety bills, gun prevention research. There should not be an and at the end of that sentence, sorry. I myself, am on the board of the Michigan chapter of the American Academy of Pediatrics, and we have done a lot in terms of providing testimony for recent gun bills, which we'll talk about at the end of this presentation, and encouraging our legislators to protect our children. So what can you personally do, or what can you tell people in your community to do to keep their kids safe from firearm violence? So something I feel like I say a lot in the office is the safest thing is to not have the gun stored inside the house. Now, that's not realistic for a lot of people if they are firearm owners, whether it's for hunting or whatever it might be for. But I always stress that the kids are safest when firearms are stored outside of the home. If that's not possible, then the second safest would be to have a firearm that is unloaded. So ammunition is separate from the gun and locked away. So whether that means that the firearms are in a lockbox or safe, and then the ammunition separately is in a lockbox or safe, or the firearm is unloaded with a lock on it, and then the ammunition is separate. So keeping those separate is the second safest way to keep children safe. And again, kids who are as young as 2 or 3 years of age can trigger a gun. So, thinking about this just naturally as you would think about childproofing a home. So we think about mounting a TV instead of having it on a lower surface where it could fall on a child. We think about having the locks on cupboards. We think about storing our cleaning products separately. So just as much as you think about that, if you are a gun owner, you should also think about, or if you know someone who owns a gun with, and they have children, we should be thinking about this kind of in the steps of thinking about childproofing a home. The second thing that we can do, that we encourage parents to do, or aunts, uncles, grandparents, asking other parents about gun storage in the home. So I really liked this to the right. So examples of how you can ask other parents about guns in their home, because sometimes this might be a little bit more intimidating maybe to ask friends or to ask, your kids' friends, parents. So focusing on yourself, how you might be nervous about guns, focusing on your child. My child's really curious. I know my almost 2-year-old gets into literally everything in our house. He loves to explore and open drawers and open, anything that he can. So just saying, hey, my kid's really curious, or focusing on the news. I mean, there's been a lot in the news recently, so I think that would be another route to take. I myself, my father-in-law likes to hunt and he owns many guns. And we had to have that conversation when I was pregnant with my first child of, he was not storing his guns and ammo separately. I don't even think they were in a lockbox at all. So, we talked about him buying a lockbox, storing ammunition separately from guns, and about the implications of if that didn't happen, then my son would likely not go to that house. And kind of being very sure of yourself when you talk about these kinds of things. The image on the left talks, just about how you might ask about pets. Do you have any dogs in the home? Any allergies? My kid has an allergy to peanuts or something, so we need to keep him away from that. just as you would. So just like you would for childproofing, just as you would ask parents about these other important questions, it's equally as important that you ask about any guns in the home as well. So another thing that I have a huge background in and have been doing is advocacy in the state. So at the state level, so what is Michigan doing to keep our kids safe? I wrote an opinion piece about a year ago now, after the Oxford High School shooting, where I talked a lot about what we can do to keep our kids safe. And I am happy to say that more recently, our state has passed through a lot of bills that will protect our children. So that, to me, a year later, you know, seeing action in our House and our Senate has been, you know, awesome. So Michigan in the past has received a grade C, which, you know, we know isn't very good, for the strength of gun laws in 2020 from the Giffords Law Center to Prevent Gun Violence. This had a lot to do with the fact that we did not have, you know, universal background check requirements that were more strict, extreme risk protection orders, things like that. So our House most recently just passed a safe storage bill. So what you need to know is that this safe storage bill, if it continues through, which we expect it to, and we expect the governor to sign it, it would require someone that has a minor in their home or reasonable expectation of having a minor. So, you know, parents, legal guardians, grandparents, anyone that might have a child in their home, to store those firearms safely. So again, safe storage means the firearm is unloaded, ammunition is out of the gun, and it is locked. The gun itself is locked, and then the ammunition is locked in a separate area, in a separate container within the house. Universal background checks and registration for firearm sales were also recently passed by the House. And then what's up next? Our legislation is working on extreme risk protection orders. So these are your red flag laws, if you've heard about them before. So essentially, it would allow a family member to petition a judge to temporarily remove firearms from an individual deemed a risk to self or others. And so if that's something that you feel very passionate about, I'll show you at the end how to find who your local legislator is to contact them. And, you know, I always encourage my parents that I see in clinic to, you know, advocate for their children, talk to your state representative, talk to your senator, because a lot of these bills that are related to firearm violence are likely going to go through and likely be passed and signed by our governor. I think the biggest thing that you can do is thank your local representative and senator for supporting these important bills, for hearing us, for kind of finally hearing us that we want to keep our kids safe. And you can even let them know what bills specifically, if any. So going back, the safe storage, universal background check, extreme risk protection orders that you support and are looking forward to seeing become a law. I also wanted to let you know that we have a state representative who is sponsoring a bill, Representative Fitzgerald, to establish a trigger lock distribution program. So he's kind of presenting new parents and legal guardians being given a firearm trigger lock immediately preceding, so before or after the birth of their child. And so that's something that you can talk to your local state representative and discuss your thoughts on, whether you agree or disagree, or, you know, think that there's a better way to distribute. But I imagine this is coming from a kind of background of wanting to provide kind of this resource for everyone, so that people don't have to, you know, worry about, where do I find a lock now? Where do I find a safe storage? And then at the federal level, if you're interested, you know, funding for research helps us a lot with understanding prevention. If you think about it, we have a lot of knowledge and research on prevention of other things for safety for children. So things like drowning, things like wearing helmets, wearing seat belts, car seats. Those are all really important things to keep kids safe. But funding for gun violence prevention has actually decreased and halted in the past decade or so. And that's because we don't have a lot of funding that goes toward it for things like the CDC and stuff. So you can always call your US congressperson and discuss the importance of research. I always encourage parents too to tell personal stories. So just like I started this with a few very quick, very brief personal stories, but things that you've seen, things that you've heard of. I tell parents I'm a mom too, and I want to keep, just as much as I want to keep all kids safe, I want to keep my kids safe as well. My son is starting, preschool in like 6 months. So thinking about him going to school and worrying about these things, this is not something that our parents in our state and our country should have to worry about. Before I end this, I do want to show you guys a few really important websites. Can you guys see my screen?
Yes.
Okay. So Healthy Children is a really good resource in general if you're looking for really anything, anything from safety and prevention to, tips and tricks and stuff. This is by the American Academy of Pediatrics, but they have a wonderful website on guns in the home and how to keep you safe. Essentially, it just went over what I went over, statistics and what to do. And then the American Academy of Pediatrics has a whole toolkit. So if you want to go a little deeper and learn more about these statistics, where they come from, what pediatricians around the country are doing. And then there are some videos that, if you want to share with people that you know. And then I always like to end with how to find your local state representative. So you can go to house.mi.gov and put in your street address. And this will take you to who your local representative is. So you can call, write a letter. It's not as scary. The first time I did it, I was very nervous. It's not as scary as it may seem. And then the same thing with your local senator. You can find my name or address on senate.michigan.gov. I greatly encourage everyone to not only keep their kids safe in their own home, but also advocate for keeping all children safe. So thank you so much for having me.
Thank you so much, Dr. Ash. We really, really appreciate all those wonderful resources and this wonderful information. Very needed. And as a family doc, it's stuff that we're going over in our visits for kids as well. And it's just a really important context for people to have. And it also helps people understand like what to expect when they go to the doctor, right? They should expect that they will get asked, and they should know this, and they should have some context for this. So we really appreciate your expertise.
Yeah, definitely. Thanks for having me.
Thank you. All right. And in the space of safety, we've been talking about pediatric gun safety. Dr. Leroff is going to talk to us about how we can be safe with our sexual practices and talk to us a little bit about what we know about sexually transmitted infections in Flint and how we can prevent those and what treatment looks like. So thank you so much for being with us here today, Dr.
Sure, absolutely. Thank you for having me. So I'm going to kind of focus on the big picture of sexually transmitted infections, and then I am going to kind of hone in more on Genesee County. I do want to say that, with this type of material, we're going to be talking about risk factors such as race and specific sexual behaviors. Sometimes in public health literature, the terminology used for these can be a little bit reductive, but they're just trying to really hone in on, what specific groups may be at risk for certain types of infections. So if anybody has any questions about any of this at any time, please feel free to unmute yourself and ask me, or put it in the Q&A, and I'll have my contact information at the end if there's any other specific questions.
So it looks like we've got 20 minutes. And so I see some questions popping up. So I'll make sure to field questions for you as they come up.
For sure. So just we're going to first discuss an overview of the problem, and then I'm going to hone in on some specific sexually transmitted infections, some of which you have likely heard of before, such as chlamydia, gonorrhea, syphilis, and HIV, but I'll also briefly touch on Mycoplasma genitalium, which is kind of an emerging infection that I think everybody should at least hear about. And then I'll end with some discussion about pre-exposure prophylaxis. And we can talk further about ways to avoid other STIs if there's specific questions about that as well. So beyond just being sexually transmitted infections, what's the big deal? So in general, having a sexually transmitted infection such as syphilis, gonorrhea, or chlamydia can increase the risk of HIV transmission. So controlling other STIs is also essential to controlling transmission of HIV. If not treated, they can result in infertility, inflammation resulting in acute and chronic lower abdominal or pelvic pain in women. They can lead to ectopic pregnancy. They can be associated with maternal death, also first trimester abortion, as well as neonatal eye infections if not treated until time of delivery, which is actually the leading cause of blindness worldwide, although it's not in the United States. And then in the context of syphilis, it can cause long-term disease if left untreated. It can also result in neurologic disease at any stage, and if not treated at time of delivery and during pregnancy, can result in neonatal infection. So in general, let me just move this here. So in general, there are particular subgroups in the United States with higher rates of STIs than others. 32% of all cases of chlamydia, gonorrhea, and primary and secondary syphilis were among non-Hispanic Black individuals, even though they made up only 12% of the US. There is also a disproportionate rate of these infections among men who have sex with men, such as gay or bisexual men. And the specific groups most affected tend to be young people between the ages of 19 and 25. Over half of all reported cases of STDs were among adults and adolescents between 15 and 24. I do want to emphasize, though, that these disparities are unlikely explained by specific differences in sexual behavior. There has been a lot of research, especially more recently, that it's not specifically that these individuals are being more irresponsible, but that there are just higher rates of prevalence in these communities, which may reflect differential access to quality sexual health care, as well as differences in sexual network characteristics, but not as much in individual behavior. And I really want to emphasize that point because I think there still is a significant amount of stigma and shame associated with sexually transmitted infections that really has no business being there. So overall, there have been increasing rates of STIs nationally. A lot of it has really ballooned during the pandemic, even though some of the more recent data about this is just coming in. In the 2020 STD surveillance report, this was a national report, the rate of gonorrhea had increased 10%, primary and secondary syphilis had increased 7%, syphilis among newborns had increased 15%, and this is part of a 235% increase since 2016. Chlamydia had decreased, but this was suspected to be due to undertesting. And some of the reasons for this may be due to the reduced frequency of in-person healthcare services, a reduced number of routine visits, diversion of public health staff from STI clinics to other things such as COVID testing and surveillance, STD testing and laboratory supply shortages as those resources got diverted, lapses in insurance coverage due to unemployment, and then telehealth practices that didn't enable the in-person screening that was more prevalent prior to telehealth. So this is just an example of the weekly reported STD cases after the COVID-19 stay-at-home orders in 2020 versus 2019, and you can see that really just the rates of everything went up as compared to the rates in 2019. Oops. So in Michigan, chlamydia is the most common STI. Second is gonorrhea. The third is primary and secondary syphilis. And then by gender in Michigan, for every 1 male, 2 females are diagnosed with chlamydia. Gonorrhea is contracted at about a 1-to-1 ratio. And for syphilis, just like nationally, it is much more common, 10 times more common to be diagnosed in men than women. So in Michigan, at a glance, you can see this is just the data to support what I was just saying. In 2021, there were about 46,000 cases of chlamydia diagnosed, 22,000 cases of gonorrhea. 1,000 cases of latent syphilis, and then about 1,000 of primary and secondary syphilis. The rates of all of these are increasing to stable overall, which is a little bit discouraging because we may not be making the type of progress we want to see on treatment of these infections. A little bit about screening. All adults and adolescents from ages 13 to 64 should be tested at least once for HIV. All sexually active women younger than 25 years old should be tested for gonorrhea and chlamydia every year. And then women 25 and older with new or multiple sex partners should be tested for gonorrhea and chlamydia every year. Everyone who is pregnant should be tested for syphilis, HIV, hepatitis B, and hepatitis C early on in pregnancy. And then those with specific risk factors should be re-tested as needed. All sexually active, gay, bisexual, and other men who have sex with men should be tested at least once a year for syphilis, chlamydia, and gonorrhea. They should also be tested once a year for HIV, as well as once a year for hepatitis C if they have concurrent HIV. And then anyone who has any specific sexual behaviors that could place them at risk for infection or shares injection drug needles should get tested for HIV once a year. And then people engaging in oral or anal sex should really be talking to their provider about that because they can be tested for STIs at specific sites of exposure. So as we talked about, chlamydia is the most frequently reported STI. However, it's often asymptomatic. About 75% of women and 50% of men with this are asymptomatic. And it can result in long-term complications as discussed earlier, such as pelvic inflammatory disease, ectopic pregnancy, or infertility. And given that it is so often asymptomatic, that is why screening, even when asymptomatic, is necessary. Chlamydia can also be an oropharyngeal infection, but the clinical significance of it, as far as the contribution of it to transmission overall in the public health community, is a little bit unclear, as the prevalence when tested directly is low, even among populations engaging in oral sex. Overall, the rates of reported cases in the United States, it's definitely most common among individuals 20 to 24. In Michigan, this data is the data in Michigan of the rate per 100,000. And you can see it's really not changed much. It's not really improved much overall, the overall trend. Even though it seems numerically like there was a little bit of a blip, it's been pretty stable over the last 10 years. In general, women make up 66% of chlamydia cases in Michigan. Black women have a 6.1 time higher chlamydia rate than white women. So we do see racial disparities in these STIs in Michigan as well. The jurisdictions with the highest case rates, Genesee County comes in 5th here at 663.5 cases per 100,000 persons. In general, it's important to note that a lot of these sexually transmitted infections are often co-infections. So 12% of all chlamydia patients were co-diagnosed with gonorrhea, and then about 1/3 of all gonorrhea patients were co-diagnosed with chlamydia. So that's why in these recommendations, testing for multiple infections, both chlamydia and gonorrhea, is usually recommended. And that, you know, among 20 to 24-year-olds, it's 33%, and a little bit less than 30% among 15 to 19-year-olds. And then about 30% of all co-infections were among Black women. Gonorrhea is also often asymptomatic until complications have occurred. In women, the dominant symptoms are vaginal discharge, dysuria, intermenstrual bleeding, similar symptoms for chlamydia. In men, when it's symptomatic, you may have a little bit of urethral discharge. Oropharyngeal gonorrhea is an important route of transmission for gonorrhea. And one of the concerns is that the antibiotics used to treat gonorrhea don't get as good tissue levels in the oropharynx. So we'll talk about it in a little bit, but there is a real risk of there being drug-resistant gonorrhea in all of our lifetimes. So testing at all sites and making sure to treat for all sites, and then to do repeat testing for oropharyngeal gonorrhea after treatment is important. Overall, there has been increasing rates of gonorrhea reported nationally. Over time, there has also been in Michigan an increased rate of gonorrhea. The rates have increased about 8% annually on average, but then from 2019 to 2021, again, thought to be related to the pandemic, gonorrhea cases increased 21%, even though the testing went down. Overall, gonorrhea is most common in Michigan among those 20 to 24, and there are differential rates seen in different populations. Blacks, African Americans have a 13-time higher rate of gonorrhea infection than white individuals in the state of Michigan. And among men, this disparity is even higher, with Black men having a rate of diagnosis 19 times more than white individuals. And this disparity is going in the wrong direction. It is increasing instead of decreasing. Overall, 45% of cases were diagnosed among those who are less than 25 years old. Again, that really high risk rate is 15 to 29. And 20 to 24-year-olds have the highest rate of gonorrhea diagnosis of all age groups. Genesee County is actually ranked third in the state of Michigan by county for case rate per 100,000 persons at 425 cases per 100,000 persons. And then I'm not going to go through all of this because it's a little bit granular and in the weeds, but this is just a timeline. And the main point of this slide is just to show that drug-resistant gonorrhea was first found in 1993. And currently, there are increasing number of treatment failures to all antibiotics. Initially, we used ciprofloxacin and cephalosporins to treat it. And then ciprofloxacin, fluoroquinolone resistance became so widespread that we could no longer use that antibiotic. And now we also no longer use azithromycin. And we're really stuck with one antibiotic to treat gonorrhea infections, and that is antibiotics in the cephalosporin class, specifically ceftriaxone. But there have been found cases of gonorrhea resistant to all antibiotics that we have. And it's estimated in the United States that there are about 550,000 drug-resistant gonorrhea infections. And there's just really increasing resistance and increasing susceptibility of gonorrhea to cephalosporins requiring higher doses. In Europe, they already, as standard of care, treat with 1 gram of ceftriaxone because of the increasing resistance and the prevalence of that in Europe. So in the United States, the standard dose is 0.5 grams. So I just want to put this all on your radar that gonorrhea is a really important infection to keep an eye on. And Mycoplasma genitalium, this is a sexually transmitted infection that many of you may not have heard of. It's very small, slow-growing bacteria. It's not really grown in the lab. It's primarily diagnosed by like PCR testing, and it can cause spectrum of disease from cervicitis to urethritis, pelvic inflammatory disease, preterm delivery, infertility. It has a prevalence of 1.7% among people aged 14 to 59 in the United States, and it's probably much higher than that because it's not as routinely tested as gonorrhea and chlamydia. There are higher estimates in clinic populations. Among individuals going to STI clinics, they actually found positivity of about 28.7% among men and 26% among women. It's also most common in individuals 15 to 24. It also has racial disparities. It has higher rates of prevalence among Black participants in a lot of these surveys than among white participants, although it hasn't been studied as nationally as gonorrhea and chlamydia and some of these other infections. Syphilis is a important infection to talk about as well. It's kind of the sexually transmitted infection that's as old as time. It is caused by a bacteria called a spirochete. There's multiple stages of it. I'm going to rush a little bit so that we can get to the pre-exposure prophylaxis discussion at the end, because I think that's very important. But in general, nationally, there are increasing rates. There are increasing rates among pregnant women nationally. There are increasing rates among men specifically. And then in Michigan, here you can see our trend has also mirrored the national trend, which is to just be increasing. From 2020 to 2021, syphilis cases increased 25%, the steepest one-year increase observed since a local outbreak was declared in 2013. People that are most at risk for syphilis are those who in the public health community are identified as men who have sex with men, and that is generally gay and bisexual men. Men make up 79% of all primary and secondary syphilis diagnoses, higher rates among Black individuals and ethnic minorities. And the rate is 5.7 times higher among Black men than compared to white men. Gay and bisexual men make up 6% of the general population, but about 40% of all primary and secondary syphilis diagnoses in Michigan. And the most common age group for syphilis diagnosis is 25 to 29. Even though Genesee County is not listed here, this data is from 2021. I do want to highlight syphilis because in recent discussion with the Genesee County Health Department, the Michigan Department of Health and Human Services STI surveillance report that was received this month. It hasn't been widely published yet, but it was received by the Genesee County Health Department. And they found a 93% increase in the number of syphilis cases reported from 2021 to 2022 within Genesee County, at 61 cases in 2021 to 118 cases in 2022. So something is happening in Genesee County with syphilis, and we all really need to keep an eye on it and make sure that we are recommending testing to high-risk individuals. Congenital syphilis is something that is considered a public health disaster. It's totally preventable if you can screen and treat pregnant women. And as we are seeing the rates of syphilis increase nationally and locally, we are also seeing more cases of congenital syphilis. This data here is from Michigan. The last infection that we'll talk about specifically, and then we'll lead into PrEP, is the human immunodeficiency virus, also known as HIV. It's an RNA retrovirus that incorporates itself into host DNA and leads to destruction of a type of immune cell called a white blood cell. And over time, it can lead to profound immune deficiency and infection by things that people without this virus wouldn't otherwise have infection with. And we talked a little bit about it, but other STIs can lead to increased transmission of HIV. So that's one of the reasons why it's really important to screen and treat all STIs. You can see here that Genesee County is third in the rate of new HIV diagnoses per 100,000 residents at 7.7. And you can see here that over time from 2012 to present, there is a trend towards an increased rate of new diagnoses within Genesee County. In Genesee County, in the state of Michigan, Black and African American men are much more likely to be diagnosed with HIV as a case rate per 100,000 individuals. And you can see here that the highest age group of risk is 20 to 29. And if you focus on that 15 to 39, you're really getting the majority of individuals. The syphilis and HIV co-infection is a really important co-infection to pay attention to. The patterns of syphilis and HIV co-infection in Michigan, they follow other health disparities. And Black men have the highest burden of co-infection with a rate 17 times higher than white men. And with syphilis, HIV co-infection increases transmission of syphilis, and syphilis co-infection increases transmission of HIV. So there's a really important public health bidirectional relationship here. Running quickly out of time, but PrEP is the term used for pre-exposure prophylaxis. And what this is medication, oral antivirals that can be taken daily, or an intramuscular antiviral injection that can be taken monthly to every 2 months to decrease the risk of HIV transmission. Overall, there is underutilization of PrEP. If these medications are taken consistently, they can reduce the risk of transmission about 99% for sexual transmission, especially among people born male at birth. And there is a massive underutilization of it. In 2020, only about 25% of those for whom it is recommended were prescribed it. There may be some less efficacy for pre-exposure prophylaxis in the transmission of HIV for people who inject drugs, but there is a 74% reduced risk of transmission, which is still very significant. So the three options are, there's 2 pill options. Truvada is approved for all people. Descovy is another pill option, but it's only approved for people originally assigned male at birth. And this has to do with how these medications were studied and what kind of drug levels have been able to be proven in different types of tissue. And then the injectable option is called Apretude, also known as IV cabotegravir, and this can be given every 2 months. In Genesee County, I don't think that Apretude is widely available. I do want to say, because I see that I'm basically out of time, that based on the new CDC and the United States Preventative Service Task Force recommendations for who should be offered these medications, if you have people that meet those criteria, they should be covered by their insurance. So insurance used to be a huge barrier to getting these medications to people because they weren't covering them. But now, as they're part of the standard criteria, the federal criteria, coverage should not be an issue anymore for these medications. So in general, per the CDC, you meet criteria for being offered PrEP if you have had anal or vaginal sex in the past 6 months and you have a sexual partner with HIV, you've not consistently used a condom, or you've been diagnosed with a sexually transmitted infection in the last 6 months. The United States Preventative Services Task Force it has a little bit more granular criteria, but basically all individuals who have been having sex with, more than one partner with inconsistent condom use or don't know the sexual history of their partner, and individuals who inject drugs should all be offered pre-exposure prophylaxis. Before starting this, you need to make sure that you get an HIV test as well as a hepatitis B, a hepatitis C, and then in female pregnants, a pregnancy test. And then testing needs to be repeated every 3 months. It's really very important because if people are on this medication inconsistently, then they can, if they contract HIV, these medications are not a complete antiviral regimen. So if they have HIV and they're still taking PrEP, they could develop HIV resistance to other antivirals. I also want to say that there is some data that once patients are started on pre-exposure prophylaxis, they actually are more at risk for getting other STIs, probably due to less use of barrier condom contraception. And so routine STI testing for these patients with chlamydia and gonorrhea testing and syphilis testing is very important as well. And so I just want to end here. I know I'm out of time and I appreciate everyone's patience, but these are some local resources. The Genesee County Health Department is really great. They have a clinic for uninsured individuals on Wednesday mornings from 8:30 to 11 a.m. Where they do STI testing. There's a lot of really great people that work there. For specific HIV questions, there is a Michigan Department of Health and Human Services consultation line that's run with Henry Ford. Some of the drug companies like Gilead have access programs for these medications for PrEP. And then, if you have any questions or referrals here at Hurley, we're always happy to take care of any individuals for PrEP or for other STI care. And we are trying to increase the prescription of PrEP among our internal medicine residents to increase access to it in the community as well. And with that, I will conclude. Here's my email address, also my phone number. If anybody has any questions, concerns, other thoughts or ways that we can try to help decrease the transmission of these infections within the Flint community, I would be very happy to be involved. So thank you all so much for your time. I really appreciate it.
Thank you, Dr. Leroff, and we will absolutely be bringing you back because there were so many wonderful tips and things that I'm sure our community members have questions about. In fact, we've got some questions in the chat that we got to get answered. So thank you so much, everyone. We will see you next week.